Channel's Business Global with me, Juliana Olayinka, from our studios here in London. Spain has nearly 4,000 health workers infected with the coronavirus, and according to authorities, this accounts for more than 1 in 10 of total confirmed cases. Like in other countries hit hard by the virus, nurses, doctors and other health workers say they're not getting enough protective kits. Authorities and companies are scrambling to manufacture, buy and distribute more. Here in the UK, doctors have threatened to quit the NHS over a shortage of this equipment. Before the London lockdown, I spoke to one senior medical practitioner based here in Britain. Mary Akangbe is also the founder of the Zenith Global Health Awards, still scheduled to take place in Lagos later this year. I'm not sure how long, but I know you've been a medical practitioner for quite some time. Have you seen anything like this before?
Thank you for having me. No, not on this level, because in the past we've had things like this, and we've been able to manage it from the point of view of experts, the NHS and World Health Organizations and healthcare, organizations in other countries. But now there is social media, there are other things, so it's like, bigger than it is. It's scary, but at the moment the fear is being overblown.
It's quite interesting, actually. I think a lot of people do feel as if social media, for me it's WhatsApp groups, for others it's Twitter, for some it's mainstream media.
Yeah.
Do you think that sometimes people who are not experts are fueling the fear, and perhaps without that, things would be a little less panicky?
Yeah, it will be, and the government wouldn't be under so much pressure to come out, because I'm sure there are some things they must have done or said, and they think, actually, and the bad side to that is that these people who are not experts or knowledgeable, they put expert opinions forward in court. Oh, I had this from a doctor, and I had it from a lab in somewhere, and
like ibuprofen, which for many people, including myself, is a painkiller of choice, and now we're being told it either fuels COVID-19 symptoms, it doesn't. Can you put that to bed for us?
Yeah, please. And there is no scientific proof that it will do that. I've seen it from people saying, I had it from Italy, I had it from Germany. I haven't seen it from pharma, I haven't had it from WHO or Public Health England or anywhere like that. And when you think about the group of people who are susceptible and have the comorbidity, a lot of them, including myself, like you said, they are on non-steroidal. Ibuprofen is a non-steroidal. So, it's just creating more fear. And unfortunately, this group of people as well, they are always one step ahead of the government and of the healthcare professionals and experts. When they say they found a vaccine somewhere, there's information going around. If they offer you vaccine, don't take it. Hello, where are we? Do you want these things to go away, to be cured, to be settled? Or do you want the panic to continue? If they say, oh, we found a treatment and we are working on it from a reliable source, then we have the ibuprofen, scenario.
Thank you for that, Mary. Let's just go back slightly. And for those of us who aren't experts, and there are millions of us, billions of us who aren't, what exactly is the coronavirus?
Okay, so coronavirus is a strain from family of coronaviruses. It's novel. Anything in health referred to as novel means it's new. So it's a new strain. So before this coronavirus, COVID-19, now dubbed SARS-CoV-2, because it affects the respiratory system, we've had SARS before, which is still with us. Now this one is affecting all group of them affects the respiratory system anyway, but I think this is to reassure people that this is what it is. So when you think of, so they caused the SARS, the MERS, and this particular strain, because it's new, all government is doing is, escalating their processes. We've always had processes in place. I've been in NHS now for about 30 years, so we've always had processes in place. But so when there's a new outbreak, we now look into what are we going to do, why we are looking for treatment, relieving the symptoms, containment for this new strain. So this is what the government is trying to do. And when you think about viruses, they are with us everywhere we turn, every time of the day. According to scientists, experts, if you lie them together side by side, they will cover the galaxy and back. So they are with us already anyway. And with this coronavirus, they're embedded in a viron. So when they drop, in a very short time, they'll die because they don't have a cell. They exist in a host. That is why when they go into an individual, they find their way into the sacs of the lungs, which is moist, which, accommodates them, and then they multiply.
My goodness. Gosh, I think that was a little bit too explicit.
No.
I'm worried now, Mary.
No. The reason I'm saying this is to let people know that it's not something that you can just grab in the air.
It's not the flu.
Yeah. So it's different. Yes, it's fatal, but right now the fatality is being put at 3%, which is still high, but not as high as SARS at 10 or MERS at 30.
Wow.
And, we're doing things to contain it, reduce it.
I want to talk about those things,
Yeah.
Mary. We're sitting in the United Kingdom, and one of the reasons why the government have been under so much pressure and scrutiny is because the way they're responding to the outbreak is very different. In fact, every country is approaching this differently. Is this normal with a pandemic, or should there be just one process of information that's coming from who? Because at the moment, the only thing I think is universal is that you should wash your hands and stop shaking hands.
Yeah. So the WHO should come out with, a universal approach, but each country will take the universal approach and examine it and see how it's applicable to them. Because population is different, geographical location is different, demography is different. So they have to look into how, and there's commerce, so they have to look into how all of this will work. The most important thing is they have the stages in place. The danger is when stages are delayed, hoping it will go away. It's not going to go away, but we're going to overcome this as well, and it's either going to be endemic or it will go away completely.
Wow. Let me ask, I listened to a report from WHO this morning. Of course, we're seeing a reduction in China. Europe is now very much the epicenter. But they said that they are seeing an increase of cases in Africa and Southeast Asia. In fact, there are some sources who I've spoken to, who I won't name, in Africa that believe that a lot of cases are being unreported. Is this worrying? Is there any truth to this, Mary?
No, I don't think cases are being reported. Don't forget that it started in China at a certain time. And these things have periods. There's incubation period. This is the most dangerous because this is time you don't know who's got what.
Can you explain what an incubation period is?
Okay, so sometimes it takes between 7 to 14 days, which explains the self-isolation. Okay. Because that is when the symptoms either aggravate or it goes away and you think, okay, maybe I've just got the standard flu or cold, or maybe...
Because people are scared to cough at the moment,
I
Mary.
know.
Or sneeze.
People look at you, even when you are not coughing, it's like they're expecting you to cough anytime from now.
We shouldn't laugh, but that's the panic we're living in.
I know. And
yes, please continue.
Yeah, and we will come to the panic and the self-isolation in a minute. And that's why the government have advised that people should self-isolate for 7 or 14 days, so that the incubation period will determine whether it's full-blown COVID-19 or you just have this symptom which can be treated and, you'll be okay. So China have gone past that period. They've had a full-blown, they've contained it, they've quarantined, they've done all the processes, and they've come up with different ideas. What we need to do is look at what they've done, because we're a little bit behind them.
Sadly, that's all we have time for today, but do get in touch with your comments and suggestions. I'll see you at the same time next week for more in-depth business analysis on Channel's Business Global. Goodbye.